All right, cool. So again, Commissioner Shenise Turner-Sloss, thank you for coming out and today, and certainly appreciate your time and the impact that you're having in the city of Dayton. So again, thank you for coming out today.
Likewise, thank you for the opportunity.
So again, we are the Dayton Area Youth Group Home Association, and we are an association of local operators who are committed to quality care, quality programming, transparency, and working collectively. So this is our leadership team, and these are various entities, individuals that group home operators and things like that. So by the numbers, we have 40 is the number of hours of training that's required for group home staff prior to being on shift. The trainings need to cover topics like de-escalation, trauma-informed training, emergency procedures, supervision and safety. 24, that's the number of annual hours of required training. So after the 40 hours, there's an additional 24 hours of per year of training that staff. And again, those same areas: de-escalation, trauma-informed training, emergency procedures, supervision and safety. 100%. All group homes in the state of Ohio must be a qualified residential treatment program and must be accredited in order to be licensed to operate. $1.9 million. That's the amount of these group homes contribute to the local tax base. 350 to 450. That is the average daily rate of reimbursement that group homes get for providing 24-hour care. 9, that's the average number of site visits a group home receives in a week. And these are unannounced and announced site visits. So individuals like caseworkers, guardian ad litems, parole officers, therapists, case managers, law enforcement, social workers, and these last for at least 20 minutes. So the situation is that, again, we have the concern that of the quality of care that they're experiencing in the Dayton group homes, and that there's a concentration of Dayton group homes is too high, approximately 70 group homes in the city.
May I pose a question?
Absolutely.
So the 9 site visits that occur annually that you said last about 20 minutes, what are some of the top level concerns or areas that the site visit covers?
That's a great
or
question.
addresses?
Well, so one of the site visits is required for the caseworker. And so that caseworker, they'll come in, they'll look at the child, they'll look at the child's room. Some of them have gone in the refrigerator. And they're just looking for the evidence that proper supervision is going on and that the child has everything that they need to be taken care of. So, and then you, again, depending on how heavy that kid's caseload is, then if they have a parole officer, then that parole officer comes to visit. And again, they're kind of not what they don't necessarily go in the refrigerator, but they still are checking to make sure that the surroundings are conducive and safe. And even when caseworkers from other kids, so a caseworker from a different county, they come in looking for the same thing. They're trained to do that. So when we talk about 9, it's not necessarily for the same kid, but if you have 4 to 5 kids in a group home, you're going to have at least two entities represented by people that are going to be coming and putting eyes on that child. Did that help?
As far as evaluate or reviewing the school attendance or the school records?
Caseworkers would do that, yes.
Caseworkers, okay.
Yeah, they would do that. And what happens is if a kid is absent, actually the school actually has to call the caseworker, because the caseworker is the representative, quote unquote, parent in that situation. Does that make sense?
Yes, I'm tracking.
Yep. So, but we're good with that question. So that's that was the presentation. And we had talked about, were there any other concerns that the city of Dayton had with group homes? I think those were already answered. And then what can we do to help? And that's really, what can we do to bring, to be a positive in this situation?
Okay, so I would just first, again, thank you for the opportunity. Thank you for the high level overview of the organization and the collective efforts. Just a disclaimer, so you know that there's 5 members of the commission. I speak as one individual, one vote.
Yes.
We are elected at large, meaning that we service all of the residents in the city of Dayton. That we're not by district or wards, whatever have you. So with that, again, I'm speaking on behalf of myself, Shenise Turner-Sloss, Commissioner Turner-Sloss. And what I would tell you is that, to answer your first question, from my understanding, the moratorium, well, first let me back up and say like where the concerns were raised and why they were raised, I should
Okay.
say.
Yep.
So I personally received a number of calls in regards to the oversaturation of group homes, and then the upkeep of the properties, as well as the care of some of the members and that are participants in the group home, or the youth that are residing in the group homes. And so it raised the red flags and just kind of like asked for an assessment. So at the time, my legislative aide, I asked for her to do a review, an assessment, if you will, of give me all of the group homes in the Dayton area, plot them out, and then I also asked for us to have detailed conversation, because from my understanding, to me, it was a no-brainer. It was around zoning. The fact
Yes.
that we're very loose, in my personal opinion, and there is a lack of enforcement, in my opinion, and hence the reason why we're seeing this influx of group homes, not just even with the youth group homes, but sober living homes, just an array, if you will, of a number of facilities that we're seeing in the day. Work in conjunction with the Dayton Department, and they really heard some of those facility where there were a number of calls that were made.
Yes.
Unruly behavior, or disorderly conduct, if you will, or just,
Yes.
I would use the terms like, I don't want to say AWOL, but missing, if you will.
Hmm.
And so the PD was able to track and to identify those properties in which they obtained a number of calls. And so it became alarming for city services, because again, it was pulling on a lot of the
Right.
safety services from
Yeah.
EMS as well as PD. So that information again was pulled. Then there were some other internal conversations with zoning, and so they wanted to look at it further to see, okay, is it really truly zoning, and also making sure that it doesn't, that there also is in lines with the protective class, and that it doesn't violate or contradict, if you will, any fair housing laws. So
Hmm.
with all that being said, so the information was pulled. Ohio Job and Family Services, they were also a part of the conversation, and really trying to identify what the concerns were. So fast forward, hence the reason why the meeting was, I think it was scheduled and held back in, it was either April or May of
Yeah.
this year. And so one of the things that I will say too that was very eye-opening and actually just reaffirming is that I remember when one of the young ladies who were a participant in the meeting, she actually she stood up and she said, because the question was posed like, why Dayton? And she, stood up and she said, because it's allowed. And so I think that was one of and it just again reaffirmed.
Well, and she certainly didn't speak for all of us. I could
Yeah,
say that.
no, she did exactly. She did, and then she did give that disclaimer as well. Like, I'm not speaking for
She didn't.
everyone, but because of the
I
zoning.
would probably say a minority she was speaking for, a tiny sliver, but
Exactly. And she did mention that, and she did speak very candidly and honestly
yeah,
and
she
so
did.
and transparently to say that I'm not an operator, but she in fact works with a number of group homes, if you will. I don't So she was speaking from her experience in that. And I don't think again her comments was not to throw any shade or any slight any of the providers that are in
Yeah.
fact providing that level of care and service to the youth. So
Hmm.
fast forward,
Yeah.
the moratorium is in place. From my understanding, the moratorium is in place until December. I don't know it's going to be per the direction of the commission collectively whether the moratorium will be extended or not. I think there's still further research and review that is being conducted as to see as to what in fact what provisions or what could be um the overall means of addressing the concerns over the
Yeah.
oversaturation in the Dayton area.
And I think that is a perfect segue because our game plan, and you've been so helpful in terms of providing direction and guidance and how to move forward. But again, we want to review the data with law enforcement and children's ER and to get access to real-time disaggregated data. That's happening on the law enforcement side. That happened. We're getting reports now of the call reports to the
That's
houses.
excellent. Excellent.
So and what it does on our end as group homes, that this association, which goes back to quality care. Okay, let's look at what we're doing here. Let's look at what we're doing and let's do it better. Let's make sure, and so having that data is very helpful. Number two is training our staff members on alternatives to non-emergency calls to law enforcement. So that goes back to from in the group home residential care world. That's that trauma informed care that you hear about. That's the de-escalation that you hear about. Those things, those kind of trainings go directly to not having to call the police in every single situation that gets escalated. Connecting with existing resources. So I know DPT, Dayton Police Department, they at one point had a crisis response team. So, and those are specifically for non-emergency mental health calls. We don't know if that still exists. We haven't been able to have that kind of conversation, but this is kind of the direction that we want to go in. And I wanted just to make sure as an association, is this something that from a city commission standpoint, from a community standpoint, is this something that would be in line, or what are your thoughts?
In terms of having um, that collective means of sharing data and working together. Let me make sure I'm
Yes.
following in terms of what
Well,
the
so the
question.
data, but then also working with the powers that be, city commission, various neighborhood,
Mhm.
you know, this is what, as an association, this is our way forward. And before we
Okay.
got too far down the road, again, just checking in with you to make sure, like, is this something that, again, with your colleagues, that they would be open and receptive to hear about? Basically, I guess, for lack of a better term, we felt like as an association, we feel like we haven't been at the table prior to all of this. And
Yeah.
we
No,
want to be
that
at the
that's
table going
no,
forward.
that's fair. No, I think personally, I would I would like to see that relationship is formed and that there is a means of us working collectively together to address any concerns or
Yeah.
and at the end of the day too, making sure and I will venture to say, and I know this to be true. I think that's the sentiments of all of my colleagues, is to make sure, in fact, that the youth um, that are in the group homes are receiving the quality care.
Quality. Yes, ma'am.
Um,
Absolutely.
so I think that's the underlying issue, is making sure that they are in fact receiving that quality care, and having that partnership and working together collectively, because at the end of the day, the group homes are not going anywhere. We know that it's unfortunate but fortunate that that service is available, to those youth who are experiencing trauma, and a number of um, adverse conditions that affect their quality of life. And so the ideal is for the group homes to step in to provide, and a means of enhancing, and improving their quality of life, so that they too can become productive members of society, um, outside of whatever underlining, unfortunate circumstances or situations that they may have dealt with. So again, that is my goal personally, is to make sure that we are working together and that you all are a part of the conversation. And I will continue to advocate to make sure that you and other, service providers and the organization in itself are a part of the conversations, so that we can move together collectively and address the overall concern. So again, that's me speaking personally. I don't,
Sure.
I don't have any qualms with that whatsoever, and I would wholeheartedly support that in any
Yeah.
means and ways that I can.
And we also understand the city standpoint. We get that this can be a drain on city resources. And so, we certainly don't want to be a drain. We want to be, a part of the solution. So thank you for that. And is there are there anything closing? I know, well, just we had also put together a friend of the city commission, a letter. Has that been received yet, or what are our next steps in that area, in that process?
Excuse me. I apologize. So what I would tell you too, so two things. One is, I already mentioned, don't know the status that the moratorium is supposed to end or expired, if you will, in December. Don't know, if it will be extended or not. And that is simply the pause for any new applications or any new,
Yeah.
interest in group homes. And then I will add too that, from my understanding, there is, and you may want to monitor this closely, and I can give you some of the details. But there are now a couple of representatives in the area. They're looking at some state legislation,
Hmm.
to improve the quality of their services
Yes.
for the group homes. So I don't know if you are aware of that. Again, I
Very.
think that, what I think is Bill 96. Don't quote me on that bill. And I apologize if I have the bill incorrectly, but I'll make sure that I give that, to you. But I do
Okay.
believe it's either Bill 95 or 96. But again, don't quote me on that. I do know that it's something that is, being introduced at the state level. So that's something that I think we all should be monitoring very closely. And then I would encourage too, for you to have the conversations with the state legislators, with the representatives, to see, in fact, what, one, reading the legislation, the proposed legislation, and seeing what the concerns are, and seeing if it, adds any layer of, bureaucracy, or if there's, or if there's a means of enhancing that quality of service that we all are, are ultimately pushing for.
Yes.
So, and then the other thing that I would encourage you to do is, I would encourage you to, send that letter to all of the members of the commission if you haven't already. And then I would encourage you to, attend a commission meeting, and to, perhaps read that letter and ask for the commission support. And again, you have my support in making sure that we have a follow-up meeting and discussion, so that we can really try to identify a means and ways, as a way forward, before anything is proposed, in terms of if there is any zoning changes or any, additional legislation that may be proposed. So I think it's an opportunity to do that now, as we are starting to approach the tentative expiration of the moratorium, and that is in December of this year.
Okay. Well, I
Does that
certainly
make
thank you.
sense?
Absolutely. Yes, ma'am.
Okay.
Yeah.
And again, please feel free to reach out. Whatever I can do to be of support, I am here to support. If you need me to look over anything, I extend that offer as well. If you want to meet back up, whatever the case may be, then again,
Yes,
please feel
ma'am.
free to reach out.
We sure
Do you
will.
have
We
any
sure
other
will.
questions for me?
No, ma'am. Al, you have any questions? Okay. Well, we certainly thank you for this. And again, we're gonna send this out to our members. Some I
Okay.
think already know you, so they may come up and say and talk with you. But yeah, so thank you for
No,
that.
please. Again, I extend that offer to any and all of the members. You have my public cell phone number. You can share that with the others if they want to contact me, if they want to meet
Yes,
in
ma'am.
person, whatever the case may be. Again, I'm here to be of service and to provide that level of support. And I would encourage you all to make sure that you reach out to all of the members as well. But Mr. Phillips, does that make any sense? Do you have any questions? Are you tracking in terms of what we discussed this morning? Did I leave anything out or?
I think you did a wonderful job. I really want to thank you for taking the time to share with you. This could be a hairy situation, and it's just so wonderful to have a city official to reach out to us because I think everybody's concern is the kids, and to make sure that the young people are getting the type of services that they definitely deserve. And so we are thankful for your participation and for your reaching out and just staying in communication, because communication is really what's going to make this thing happen and go to the next level. So thank you so much for sharing and spending the time with us today. We appreciate it.
Absolutely. Thank you. Likewise. And like I said, if we want to work together and getting another meeting set up, initially the meeting was held and hosted by the city. So perhaps this is an opportunity for the organization to host a meeting so
Mm,
that the providers, various entities, organizations, they can hear what the concerns are and the perspectives from the providers.
okay.
So maybe that's something that you all may, after the first of the year, maybe
Mhm.
it's an opportunity so that you can start planning, organizing, getting a number of the players at the table,
Yes.
reviewing that legislation, that proposed legislation. And then again, it may be an opportunity for you all to host a meeting,
Oh, that would be
Mhm.
great.
Yep. Absolutely.
and not necessarily waiting on the city to host it. And like I said, I'll be more than willing to support you all on that and whatever it is that you need me to do to help to do so.
Absolutely. Thank you. That's great.
That's great.
Well, thanks
Okay.
again, Commissioner. We appreciate you.
All right. Thank you
All right.
all. Happy holidays. Be in
Same to
touch. All
you.
right. Take care. Bye-bye.
Bye now.
Bye-bye.